Good morning, everyone. It is another fantastic Monday morning here at Health Fund Markets, and we are going to start the tradition of starting on time as best we can. So, again, we are here to improve the lives of our community with affordable health care. Thank you for being a part of that mission, and thank you for being here live on these calls so you can get the updates as quick as possible, and you can start your week off the right way, getting the information you need to get started first. So good morning, everyone. I hope everyone had a fantastic week and weekend last week. We closed out the month of June yesterday, June 30th, and we are off to a new month today. It is July 1st. It's also the start of quarter 3, and we have already begun AEP 2025. We're going to talk more about that this morning. So I thank you very much for being here. As a reminder, when we get closer and closer to AEP, these calls are going to be recorded, and we're going to do our best to ensure that you get this information as quick as possible. So with that, we're going to start as we normally do. We've got to keep one foot in the classroom and the other one in the field at all times. So I am going to share my screen here with All right, the first thing is I want to remind everybody that we do have our AHIP link, which is available. You all should have gotten that, and I'm going to show you exactly how to get to our AHIP link. Those of you that attended our benefit advisor meeting last week, we talked about how important it is to get your AHIP done early now. The AHIP for 2025 is launched, and we do have our own AHIP link available for you to use. Now, one of the things that I want to point out here this morning is many of the carriers are promoting their own link, and that's great. However, there's some mixed messaging in that, and I want to make sure that it is clarified this morning. Some carriers in the past have been able to reimburse you for your certifications. With the new CMS guidelines, that may not happen. So that's the first thing to note. Secondly, even if you use someone else's link, if they do have some kind of sales contest where they're able to reimburse you for your AHIP, it has nothing to do with whether or not you use their link. But some of the verbiage sounds like if you don't use their link, you're not going to get reimbursed. So that's not the case. All of everyone's AHIP link automatically gives you a $50 discount on your AHIP. So instead of paying $175, you pay $125 right out of the gate. And then if there's certain carriers that are reimbursing that cost, it doesn't matter which link you use as long as you got it done and you met that requirement. So with that said, I want to thank Joe Falk and Jonathan for putting together and getting over to AHIP to get our own AHIP link. I'm very proud of them to get that done. And so we've made a commitment to AHIP to provide this for you. And so a couple of things. The first thing is instead of having to chase you down for your AHIP certification, we should be able to have now a home base where we can see if you've done your certification, and we can pull down your certs without having to harass you or chase you down. And that way we can keep them in your folder and get them to the carriers as needed. Okay, so that makes it a lot more streamlined for our team, but specifically for you, so we don't have to bother you or harass you for your AHIP certification for 2025. It should also reduce the amount of emails back and forth, which is kind of the goal here too. The second thing is we're able to monitor the scores. So if you've taken the test twice, we want to call you and say, hey, whoa, don't take the test the third time, because you might find yourself all jammed up. We want to get you some tutoring, and we're going to have some sessions on that as well. So if you have any questions on that, you can reach out to the team. So that's what we've done for AHIP. Now, we have made a commitment to AHIP of providing you with this AHIP link, and we're on the hook to get 200 users on our HPM link. If we don't hit 200 users in 24 months, or by the end of, I think, AEP 26, then HPM is going to be responsible for the cost of those AHIP certifications, and we don't want that. So it would be a huge help And I would be extremely grateful if you haven't already done your AHIP, go ahead and use log in through our link at Health Plan Markets. And I'm going to show you how to get to the AHIP link this morning. So that way there's no confusion and we can get you right where you need to go. So from HQ, everyone should have access to HQ with your picture right on the top. You should have a login there. And if you don't, please send an email over to support@askhpm.com. And I'm going to put that in the chat, support@askhpm.com. Just send an email over saying, hey, I don't have HQ, I need HQ. Remember, this is your all-in-one tool that you're going to need to navigate this. I will say that the team is constantly working on this, and so if it goes down, just have a little patience, but you can always send an email back. And then we've got a chat feature I just want to make sure that everybody's aware of. You can chat here right on the left-hand side. So in case you need help, the team should be logged in this morning and taking any questions that you might have. But back to it. So if you are, let me put on my cursor here so you can see a little bit better. So from the home page on HQ, you're going to go down to contracting, and we have built a section called Recertification 25. So you can click that. And this should give you all of the information that you need for all the carriers as we're beginning to get this information. Not all the carriers are loaded yet because we haven't gotten the information from the carrier specifically. But in the AHIP, if you click AHIP, this is how you get to our link right here. And you'll know you're in the right place because on the top right corner, it'll say Health Plan Markets here. So you're good to go. So thank you for using that link. Also, the team is going to continue to be working on the recertifications and putting them in alphabetical order. We just got some updates from Aetna, Devoted. Those certifications are live, and they've got a certification video, user guide, which should walk you through on how to get in and get these certifications done. Now, if you're not currently contracted with one of the carriers and it's your first time certifying, you do not go to recertification. Recertification specifically means that, hey, the recertification, you've already been certified and you're recertifying for 2025. If it's the first time you're certifying, do not use this link. You need to request that from contracting, and you can do so by clicking Meet with Contracting, and they can go ahead and you can grab a time to talk to them about what specific contracts that you need so you can get started on that. So we want to make sure that we want to get that done, okay? All right, so that's HQ. Remember, we've got tons of resources in here. The enrollment tools, HPM shop, Health Sherpa, it's also the CRM, so we did away with that. Commission information is in there as well. We're going to start loading the 2025 commission rates in here as well, so you can see that coming very shortly. Liam is returning back from vacation, so we're excited about that. All of our marketing catalogs, swag, and we've got direct mailer hooked up. So if you're interested in doing consistent mailers to generate leads, you can click up through that. We've got our learning center here. I'm seeing that the Monday morning call link was not working this morning for some folks, I guess. Looks like it worked for many, but there is a dial-in option here as well. So you can always dial in case you're having any trouble connecting. There's that as well. So we'll continue to add to that. And then all of our resources are here as well. So this is your all-in-one tool. If you have a suggestion on how to make this portal better for yourself, please go up to feedback. You can click feedback and let us know, hey, how would you like this improved? Your feedback is critical in making this a lot better and more viable for you. So, I kind of went off on a tangent on that. Let's get out of HQ. Let's go back to the training calendar here. And so for the training for this week, it is a holiday week. So the first thing I want to mention is Health Plan Markets is going to close on Wednesday, July 3rd at 1 p.m. It's going to be a half day for us. Wednesday, July 3rd, 1 p.m. we will close. So we're working a half day from 9 to 1. And then we'll be closed after 1 o'clock on Wednesday. You should receive an email from us later this week. Thursday, obviously, we're going to be closed for Independence Day, July 4th. Everyone, please be safe and have fun. And then Friday, we know that you're not coming back. Too many hot dogs, too many hamburgers. you're gonna not feel so great on Friday. But I hope everyone stays safe. So we will also be closed on Friday. So July 4th, July 5th, we will be closed, and we will return to work normal business hours on July 8th. So it's a short week this week. And also, we've got some folks that are going to be a little bit hard to communicate this week. The first is Gabe. Our IT manager is out until tomorrow. So he will return back to work tomorrow. We also have Liam, who's returning today. He was out for 2 weeks, so it's going to take him a little bit of time just to kind of catch up, and then of course we have our short week. Now tomorrow, July 2nd, the HPM leadership team is going to be going through a new implementation to revamp our leadership and our systems. And so we will be locked into a room tomorrow working on the business instead of in the business. So I do appreciate everyone's time and attention on that, but it's business as normal. So if you have any questions, please don't hesitate to call our 844-696-3975, or again, support@askhpm.com. We've got help, and they are on the line for you tomorrow. But in case we're slow to answer, leadership will be in an implementation tomorrow, July 2nd. Okay, so just wanted to give you an update on HPM. As far as the trainings go today, if you're new to Aetna, there is a new agent broker orientation today at 1 o'clock. You can register there for that. Tuesday, tomorrow, July 2nd, Humana, know your special enrollment periods. This is how you make money now. This is how you make money now. You've got to know your SEPs. And so there's a whole class on that, which is tomorrow at 10 o'clock, hosted by Humana. United Healthcare, find and engage consumers. The name of this game. You have got to continue to push for traffic, so you can create leads, so you can create appointments, so you can create sales. That's how it goes. And then Wednesday, we've got our very own Ask Al available for a virtual coffee and chat. Virtual coffee, virtual cream, virtual sugar, but not virtual advice. This guy knows his game very well on both the Medicare Advantage and Medicare Supplement side. He is available to chat 9:30 every Wednesday, and he'll be there for you. Our contracting team is going to be available for a virtual chat. I guess no coffee on that one, but at 11 o'clock, they've got a Q&A session available every week at 11 o'clock on Wednesdays. Cigna's hosting their virtual Medicare office. So if you have any questions for Cigna, they've got theirs at 11. United Healthcare is hosting a certification study group on Wednesday, July 3rd at 2 o'clock. So if you'd like to jump up there, you are good to go. And Aetna is also doing a certification prep class at 3 o'clock. So these prep classes are actually new. I've never seen this before, study groups. Very excited to see that. And thank you to Al and Tom for coordinating all of these great trainings for you. Nothing going on the 4th or the 5th, so that's pretty much the training for the week. Remember, guys, you got to keep one foot in the classroom and the other one in the field at all times. That's just the name of the game. Couple things I do want to mention. We talked about HQ and the recertifications. The last thing that I really wanted to talk about this morning was some of the opportunities that are going to be surrounding AEP, okay? So we have not yet heard back from the Walmart stores. We have not yet heard back from the CVS's, the Walgreens, Publix's, all of the kiosks that were typically available for agents throughout AEP may not be available. Now, we did learn that Kroger, which doesn't have a lot of physical stores here in Florida, but elsewhere, if you're in Georgia or the Carolinas or anywhere else where there's a Kroger's, they are offering a table to purchase for $2,500 during AEP. It's a steep price to pay. I know many of you just said, whoa, that's too much. If you're interested in working at Kroger's, just let us know. You're going to have to let us know your top 3 choices in priority order. So this is my number 1 pick, number 2 pick, number 3 pick. And just in case you don't get your first or second pick, you have three different picks that you can go for. But just keep in mind that it's first come, first serve on that, and the first one to pay wins the store. I think it's going to be very similar to how Walmart goes. But as you remember, the Walmart Health they've gotten out of the business. They were going to go into the doctor business. They're out of it. And now, we don't know if they're going to participate in the Walmart centers this year again or not. They're still trying to figure themselves out, and we just don't really know how it's going to play down. CVS, Walgreens, those are up for debate. We haven't heard anything about Publix's. And I want to talk a little bit about why this is happening and why there's so much disruption right now this year. And one of the major reasons why is the companies are not yet 100% clear on the new CMS guidelines and what is allowable to be offered to you, the agent, because everything has a quote unquote monetary value. And CMS is saying, hey, look, we have to cap your compensation at the CMS allowable. They've already given you $100 extra with a $50 renewal for admin fees, which according to the rules may or may not include marketing support. So that's where things are kind of getting dicey, where the carriers are like, are we allowed to pay for this because you're already paying, or we're having to pay for marketing spots? There's a lot of confusion in that. And again, it's open for interpretation as far as how these carriers are really working these marketing sites and how they're going to be able to offer that. So as we learn about these opportunities, we're going to use this call to announce them, and it will be first come, first serve. So it's at your best interest to obviously be on these calls on Monday morning so you can see the opportunities that are available for you and jump on them right away. So again, as we learn about these opportunities, we'll continue to roll them out here on Mondays so you have the opportunity to snap them up. So again, the first one that we know of is Kroger's. And so if you're interested in a Kroger's, if there's a Kroger's near you and you want to work that Kroger's wherever it might be, we are happy to get that done for you. Okay. So just let us know. And again, there is a cost of $2,500. We can always work that out and figure out how we can get that taken care of. Okay. So what's the game plan? If you're not going to have different opportunities that you had in the past, what are you going to do? What can you do this AEP, and what should you be preparing for this AEP? Okay, so if you've got a pen and paper, if you're paying attention, if you're not laying in bed, grab a notepad, grab your phone. Here's a couple things that you should be doing right now to prepare for AEP 2025. Okay, so here we go. The first thing is get your certifications and recertifications done as soon as possible. Okay, you don't want to wait until the last minute to get these certifications done. They are going to be coming hot and heavy. So if you have 10, 15 different carriers, that's 10 or 15 different recertifications. On average, 2 hours per certification, 30 hours of recert time that you will need to begin investing in. Okay, so you don't have to do it all at once unless you wait to the last minute, and you don't want to do that to yourself. So as they're rolling out, make time. I'm going to give you a strategy. Do 1 certification a week. That should keep everything up to speed. If at all possible, keep doing 1 a week, and that should do the trick, and you'll have plenty of time to get done by October 1. Okay, so certifications is number 1. Now, in the meeting that we had last week at our benefit advisor meeting, and first of all, I want to thank everyone that made time, traveled to Orlando to be there in person. We really do appreciate it. But one of the things, just to recap, was that this is going to be a very tumultuous year. It is going to be disruptive. We understand that there's going to be a lot of changes. There's going to be a lot of people shopping. And just to give you some context to that statement, on a typical year, for Medicare beneficiaries, on average, 20 to 30% of Medicare beneficiaries go shopping during AEP. On a typical year, 20 to 30% of seniors go shopping for a new Medicare plan. Doesn't mean they buy anything, they just go out shopping. Now, based on everything we know with CMS, based on what we're hearing from the carriers, based on everyone kind of backing off of benefits, based on what we're seeing from the provider groups, we anticipate that over 80%, 80% of Medicare beneficiaries will be shopping this year. Okay? So putting that at the top and forefront of your mind means a couple of things. The first thing is, if 80% of Medicare beneficiaries across the country are going to start shopping for health plans this season, that means it's going to be a very, very busy year. But it also means 80% of your current book of business is also going to be shopping this year. Are you talking to your members now? Are you connecting with your members now? Are you building a relationship with your book of business now? Because if you're not, when they get their annual notification of changes, their ANOC, annual notification of changes, they're going to flip out and go to the first agent that picks up their phone. They might call Joe Namath. They might bump into somebody at a Bravo supermarket. They might pick up a postcard or a business card at the doctor's office. How tight are you with your book of business? So that's the first thing that I would be very concerned about, is staying on top. This is a retention year. It's a big retention year, but it will also drive the business for referrals. And the agents that are typically responsive and proactive are going to make a mint this year. I'm really, really excited about those agents that are going to make a mint this year because they are focused on their members and they're answering their phones and they're being proactive now, okay? Remember, guys, you only have 90 days until open enrollment begins on October 1st. This is your 90-day warning, okay? Today is go time. So what you should be doing, you should be calling your members, okay? You should be calling your members. Don't wait for the postcards to go out. Don't wait for the newsletters to go out. Don't wait. Go and talk to your members. You need to tell them, listen, this is going to be a crazy year this year. We want to let you know that you may see some crazy things. Get on the phone and start having these conversations now, okay? You have time to be on the phone now. You are not going to have time to do these activities in October. You need to do them now, okay? You need to text them. You need to email them. You need to call them. You need to have an appointment with them. You need to go see them. You should be spending your summer going to see your members. If you can go see your members, go see them now. In October, I know many of you are like, why would I see them now? I can't do anything. Because in October, you should not be going to their house. In October, November, December, you should not be going to your member's house. You should be picking up the phone and getting them enrolled remotely. It is going to save you a ton of windshield time. Do not waste your time driving around member to member to member during AEP. Okay? Many of you are doing it because you're afraid of the call recording. Get over it. No one has been fired from a call recording as I know it yet. And this has been going on for 2 years now. No one's lost their license. We've had a couple of boo-boos, yes. Some corrective actions, yes. Some coaching, yes. But no one has gotten fired. No one has gotten in trouble. Nobody went to CMS jail. Learn how to do the call recordings because it will save you so much time during AEP. I hate to see agents. How many sales did you do today? Oh, I did 5. Why did you only do 5? Well, because I had to drive from Tampa to Zephyr Hills to Lakeland to Orlando, and I can only do 5 in a day. Meanwhile, your counterpart did 15 apps in one day. 15, because they were sitting at home and they worked from 8 to 8, and they were able to crush appointments back to back to back to back to back. You cannot do that unless you're doing seminars. You cannot do that from the road. Okay? So really think about your strategy this year on how you're going to get people enrolled. Because here's the reality. You are going to need to change your book of business. This is going to be the year where many people are going to say, look, I'm not happy with that plan. What else you got? And if you're not prepared, you're going to be running around with a chicken with no head. There's no way you're going to be able to see all your book of business, and your people are going to get sniped. And then in January, you're going to wake up and say, why is my check lower? Why am I not making as much as I used to? Because you wasted your time during AEP. You need to maximize that. And if you do it well enough, you'll have enough daylight to do some prospecting to continue to grow your book of business, which is really what this is all about. Okay? Look, I'm not here to scare anybody, but I'm here to show you that this is a reality check. It's July 1st, and I don't want anyone coming to me in October telling me that, Justin, you didn't say, you didn't warn us, you didn't tell us, you didn't prepare us. I didn't know. Well, I got 43 people on this call, and maybe another 40 or something that will listen to this call later this week. But there is a massive amount of people at HPM alone that are not paying attention right now. And that's a shame. But the ones that are on this call and are listening to this video are going to win big in AEP. You're going to win big. So just by being here is really, really important. We're investing in that, and we are helping you as best we can, okay? So get those research done, talk to your members, and then the third thing that I would do is, if you come up for air and you have time to do things, what other activities could you be doing? Should you be doing tabletops? Should you be doing seminars? Are you going to be looking for a retail location? Are you going to go visit doctors? Are you going to be doing mailers? What else should you or could you be doing to grow your book of business once you take care of all your members? Okay. Now, your members should generate referrals, which is fantastic. One of the strategies that you can do at every sale, and you should be doing this at the end of the sale, Mr. Jones, I was so happy that I was able to help you today. Is there anyone else that you know that I can help as well? Do you know anyone else that I can help? And then listen to that story, right? They told you about their brother, the neighbor that just moved in, the guy down the street that just turned 65. Bring that story back and ask them to connect you with those people. Okay, I think it's really important to do that. Okay, couple of things too, just to answer some questions. Will's asking, hey, Humana closed their Altamont Springs office. Where have they relocated to? Thanks to Rosie, she notified us early that Humana is closing, I think, 99% of their centers across the country. They're just going away. I hate to say it, but the Kissimmee office is still open for now, but it looks like that one's going to be closing soon. So all of the neighborhood centers, Humana is going away from that model. Doesn't look like those are going to continue. So just keep in mind that the next best thing is these people calling Humana for customer service. And remember, they have a sales department there too. You don't want them calling customer service. You want them calling you. Have them call you, and you better tell them now, instead of during AEP when they get that letter and they're like, what do you mean my copay is XYZ? I'm not paying that. Okay. Mary Kay's on the line. She says, wondering how Recert for AHIP works when Devoted's offering me additional dollars towards AHIP fee if I go through HQ Recert. The offer to me from Devoted is due to platinum level volume. Yes. So as I discussed earlier in the call, that is not specific to the Devoted AHIP link. You do not have to go through the AHIP link through Devoted. From what I understand, you don't have to go through their link to get reimbursed for Devoted. They're just going to reimburse you for getting your AHIP done, just because you're at a platinum level with Devoted. So I wanted to make that clear. Unless there's some specific instructions where they say you have to do that, most of the carriers are kind of convoluting that. And Mary, you are at a platinum level with Devoted. Not everybody is. So, and again, we don't know if Devoted is going to stay true to that, because CMS is saying, hey, you can't reimburse for certifications. That's part of that extra $100. So again, it's really up to the carrier how they're promoting that and how they're going to stay true to that while being compliant with CMS. So there may be some more clarity on that, but I do recommend touching base with your Devoted manager if you've got somebody at Devoted that can clarify that. But it's from our understanding that you can use any AHIP link, preferably ours, so that way we can get to our numbers and get that up. I appreciate you using our link on that. And then lastly, will Spark be sending out postcards again on our behalf? I love this question because one of the main values that we have is our partnership with Spark. As long as your CRM, your Spark platform is up to date and you have all of your members in Spark, in the Spark platform, then yes, you must opt in to the AEP campaign, and you can do that on your onboarding. So if you haven't done that yet and you need help or you want to ensure that your AEP campaign is activated, then reach out to us at support@askhpm.com, and one of the IT teams will walk you through that to ensure that your AEP is ready to go for your postcards. Now, I will tell you something that's really interesting. Our previous NMA, before Spark, is sending out emails saying, hey, agent, you need to get with us to send in your clients for the book of business mailers. You need to do this and you need to do that. And it's really interesting to see because we don't have to do all that. All of that's automatic for you guys. But the thing to remember is you have to make sure that your data is accurate. So this is a great time, a fantastic time in July to call your members. Call them, start a conversation with them, check their data. Do you still live at 123 Oak Street? Is your phone number the same? Yes, because we're talking on it. Great. Hey, look, it doesn't seem like I have your email on file. I would love to send you a monthly email that has information about how awesome articles, coupons, discounts, and some fun games. Would you like me to send that email every month? Guess what, guys? Our partnership with Spark brings that to the table for you. That is tons of hours of work that you're able to provide to your clients. So now you're getting you're getting enriched data to continue to push to your members so you're staying connected, okay? Now remember, you have to opt in to the AEP campaign. If you opted in last year and haven't done anything, you are automatically opted in for 2025. You don't need to do a thing, okay? But if you did not get your postcard sent out last year, please reach out to the team and we'll ensure that that's activated. We haven't had a deadline date yet, but this is a great time to make sure that all your data is accurate. I think about halfway through August is the cutoff date to update your CRM because that's when the postcards start rolling out. I think it's like halfway through August, I think maybe late August. And then the postcards are going to start going out in late August to your book of business with your name, your picture, your phone number as well. Okay. So again, a really, really great time for you to go ahead, call your members, enrich that data, make sure that your campaigns are activated on the AEP campaigns, the newsletters. And then if you've got a significant book of business, and you're sending out birthday cards, we can do that for you as well. Handwritten, it's an extra cost, of course. I will say that up front. I think it's about $3 a card, and then Spark bills you quarterly for that. It's an additional service. You know, if you have less than 100 members, probably shouldn't even worry about that. But it's a fantastic extra touch that your members are going to get a handwritten birthday card from you on their birthday, which is fantastic. Okay, so with that, we are at time. Actually, we're a little over time. I got a little passionate about that, but I'm very, very excited about this AEP because I really do think that everyone's going to have a stellar and record-breaking year just because of how many people are going to be out there looking for you to help them with their Medicare information. So last question in the chat. Elise is asking coupons with Spark, like what? There's all sorts of coupons that they do, you know, senior discounts, you know, food discounts, coffee discounts. There's all sorts of fun stuff out there that they find and drop in the email. So if you need a sample of that or you're interested in learning more, send us an email at support@askhpm.com and we'll connect you with the Spark team to go through that. So with that, everyone, thank you for being here on Mondays. It is a short week, so I hope everyone has a fun and safe holiday week. We are blessed to be in a fantastic country that allows our freedom and allows us to work for ourselves and have the blessing of dictating when and where we can do what. So I hope everyone realizes that is the reason for this season. And I want to thank everyone on this call for being here and being a part of that. So until next Monday, have a fantastic week. Take care, everybody.